a disease that has sent the scientific community back to the drawing board. A disorder in children, which scientists call the multi-system inflammatory syndrome, has been reported in Britain, Italy, Spain, France, and the United States. An emerging twist to the pandemic, occurring days or weeks after COVID-19 illness, reflecting surprising ways in which the new coronavirus infects and affects its human hosts, and revealing just how much is still unknown about this relatively new virus.
I call on all clinicians worldwide to work with your national authorities and WHO to be on the alert and better understand this syndrome in children.
Doctors who have treated the cases say the illness mirrors many of the symptoms of the Kawasaki disease. The diagnostic criteria include persistent fever, rash, abdominal pain, bright red eyes, vomiting, swelling of the hands and feet, red cracked lips, extreme headache or sometimes breathing, and hospitalization with problems in at least 2 organs, such as the heart, the kidneys, or the lungs. Signs that the Kenyan Health Ministry says they are yet to register here.
That is an evolving area, an evolving pathogenicity of the virus, particularly in young children, that I think in due time we will learn more and see.
But for Dr. Bernard Ogutu, a scientist at the Kenya Medical Research, this is a cause for concern.
When you have a new disease and you are getting new forms of presentation, that's a cause for worry, because either you have not been able to pick it or it is not occurring in your locality. And once you see it in another place, then you need to be on the lookout and start looking at your cases very closely.
What should scientists in Kenya be doing at this moment in view of the fact that we are seeing a new kind of illness among children? We've seen cases in New York and now we've seen cases in Europe.
The cause of worry that this portends for us, those who are working in Kenya and looking after children, is that now we need to be slightly more aggressive in screening children in families where people with COVID has been diagnosed. Because if we realize that some of the speculation that this might be a delayed immune reaction to the virus and viral infection, then we should know that our children getting infected. And if they get infected, we need to keep a close watch to possibly start looking out for the occurrence of similar signs.
What are the areas then scientists should be working on? Does it mean that you go back to the drawing board?
Definitely, because of the presentation we are seeing now in children, we have to go back to the drawing board and start looking at some of these areas, especially in Europe, where now we started seeing these cases much later in the disease period, maybe 2 to 3 months after. So what might be the pointing factors that this might be a delayed reaction, as some people suggest, which means these children were infected early but didn't exhibit the classical symptoms that the adults have been coming down with, or they remained asymptomatic, but now we are seeing a delayed reaction happening, which means they also got infected early during the part of the pandemic. Or this might be, if it is something that is a reaction, basically a cytokine storm, like what has been seen with adults, because of our immune reaction, then if this is now happening after several months after the start of the epidemic, then one also needs to look at the virus itself. Might we be dealing with a virus that is changing?
In Kenya, I know for sure we are probably concentrating on the fact that we have so many asymptomatic cases. Then how should, from a scientific point of view, how should the government handle this kind of situation?
In this scenario that we are seeing children presenting with these symptoms that we have not seen before, they just makes that our testing should be much more elaborate, and we need to focus on children.
Pamela, Asigi, Citizen TV.